Hi, I'm Dr. Albert Pendleton. I want to talk to you about patella dislocation. So patella dislocations are quite common. Usually what happens is the kneecap pops out of place here. Sometimes it stays on the side and needs to be put back in by a healthcare provider or by yourself. And sometimes it dislocates and pops back on its own. When that happens, we want to look at why that happens. Sometimes people have risk factors for why those dislocations happen. Some people have loose ligaments, and when people say they're double jointed, it doesn't mean they have two joints, it just means that their collagen is looser than the rest of those folks, and so it's easier for their patella to dislocate. Some patients have knock knees. When they stand up, their knees are more bent towards the middle of their body, and that increases the chances of patella dislocation. Some people have a twist inward of their femur bone and outward of their tibia bone. That's called femoral anteversion and external tibia portion, and that increases the chance that the kneecap pops out. Some people, the groove where the kneecap lives, this is called the trochlea. The trochlea isn't put together right. Sometimes it's flat or even convex. We call that trochlear dysplasia. And in some people, the insertion of where the tendon inserts, instead of it being in line with the groove, as you can see right here, it's more off to the side, which makes it a higher chance for the kneecap to pop out. So depending on how many risk factors you have, will also help us determine what are the chances of the kneecap's going to continue to pop out. Now usually we don't do surgery for the first dislocation unless, once you dislocate the kneecap, if you knock a chunk of cartilage off the undersurface of the kneecap bone or on the end of the femur bone. If the chunk is very large and we're able to diagnose that within the first 2 weeks or so, then usually I'd recommend going in and putting that big piece of cartilage back and stabilizing it. And usually at the same time, we would go ahead and stabilize the kneecap as well at the same time. Now for those folks who dislocate their kneecap and don't do a bunch of damage, oftentimes we'll do some physical therapy, working on range of motion and strength of the knee to see if we can decrease the chances that it'll happen again. Sometimes we do a brace which buttresses the kneecap on the side to help prevent it from happening again as well. Despite those interventions, sometimes patella dislocations continue to happen, and there's never a time where you have to have surgery for this problem. It's usually you guys come to me and say, hey, I'm sick of my kneecap dislocating. I can't do the activities that I'd like to do in order to be active without worrying that my kneecap's going to dislocate. Now, if that is a scenario and you have dislocated several times and are considering doing something about it, there are several surgeries that we can do to help. The first major surgery is called a medial patellofemoral ligament reconstruction. Now that's a mouthful. Medial stands for the middle of the body versus lateral to the outside of the body. Patella is the kneecap bone, femur is the femur bone, and it's a graft that runs from the femur bone to the kneecap bone and acts as a leash so that kneecap can't run away. It doesn't hold the kneecap in place, but it prevents it from popping out of place. And in those patients where the tendon is way inserted off to the side, sometimes I'll also recommend doing what's called a tibial tubercle osteotomy. So this piece of bone where the tendon inserts is called the tibial tubercle, and osteotomy means to cut the bone. So we go in and make a small sliver of bone here and take that area where the tendon inserts and move it over so it's right in line with the groove. Both of those surgeries are a day surgery. You come in and go home the same day. I usually just keep you on crutches for 2 weeks. Right from the beginning, I allow range of motion from 0 to 90 degrees with both of those surgeries. After 2 weeks, we start being able to put full weight on it. I usually keep the brace on for 6 weeks. Not totally required, it's just as a reminder to you so that other folks know that you had a surgery on your knee. At 6 weeks, we can get rid of the brace, continuing with physical therapy, which starts right away to 1 or 2 weeks after surgery, working on range of motion and strength of the knee, and that's usually twice a week for as much as we can get, usually 3 to 4 months kind of minimum. Between 6 weeks and 3 months, we're just working on strengthening of the knee muscles, allow running at 3 months, and return to full sports between 4 to 6 months, depending on how you're doing with physical therapy. So that's just a basic overview of patella dislocations. If you have any questions, give me a holler.